Conquering frozen shoulder, my challenging path to recovery. When I initially experienced what I later identified as a frozen shoulder, the level of agony was so intense that I felt as though removing my arm was the only way to find relief. Even the slightest movement in the wrong direction would result in an acute, burning sensation radiating down my arm and extending into my neck and head, leaving me gasping in distress. Almost instantly, I found myself unable to lift my arm and losing grip strength in my left hand. Everyday tasks became daunting. Washing my hair or fastening a bra was unbearably painful. Driving brought me to tears, and sleepless nights became the norm. Although these symptoms felt unusual to me, it's been documented that frozen shoulder, or adhesive capsulitis in medical terminology, is fairly common among women going through perimenopause. What exactly triggers frozen shoulder? Research conducted by Duke University School of Medicine indicates that a decline in estrogen can affect bone growth, inflammation, and connective tissues. This may explain the association between perimenopause and frozen shoulder. When the lining of the shoulder joint becomes inflamed and overly thickened, it creates a barrier, preventing the joint from moving as it should. Say hello to your second act. Hello second act https:/hellomagazine.com/newsletter second act is a complimentary newsletter designed for women navigating the midlife phase and beyond. It offers valuable advice and inspiration on topics we, the second act community, consider important, such as health, relationships, travel, menopause, and career advice. In some cases, the condition emerges without a clear cause. However, it's believed that issues like diabetes or thyroid disorders could be contributing factors, and genetic predispositions might play a role in migrating the condition to my family. I recalled that my mother underwent keyhole surgery on her shoulder 2 decades ago, suggesting that she might have experienced the same ailment. My treatment journey for frozen shoulder. When I sought medical help for my frozen shoulder, my doctor prescribed a steroid injection without even checking my range of movement. Wary of having drugs stabbed into my joint before I knew for sure I had the issue, I requested an MRI to see the extent of damage I was working with. I was prescribed strong painkillers, but they did nothing to stop the pain. Post-MRI, my scan showed that the socket of my shoulder had indeed become inflamed and was causing a lot of pain. Thankfully, I was referred to physio Carlos Cobiaya at the shoulder practice, whose patients I booked in for a steroid injection with ultrasound to make sure the correct place was being targeted. Within days, a little bit of pain disappeared, and I was starting to get the feeling back in my fingers. But it took over a year for any kind of movement to return. Thankfully, a year on from my steroid injection, I am still relatively pain-free, and my mobility, while not perfect, has begun to dramatically improve. Strategies to help relieve frozen shoulder pain, groundbreaking in part via Carlos Cobiaya, and steroid injections, such as the one I had administered, should be conquered by referral practice who understands the complications of the condition, but primarily treats arthritis. If you're in perimenopause, it's been shown to diminish estrogen levels, which can lead to inflammatory-related issues. Frozen shoulder sees the lining of your shoulder joint becoming inflamed and thickening, causing